Hello and welcome everyone for joining us, and welcome especially the UN Press Corps. My name is Sarah Crowe and I'm with Unicef's Office of Research in Achenti, and it's my pleasure to be moderating today's launch of the 2020 report, Protect the Progress, Rise, Refocus, Recover. The report is the global health strategy, Every Woman, Every Child, a special partnership that brings together these distinguished speakers here today. Let me first start by welcoming Her Excellencies, President Kirsti Kaljulaid of Estonia and Prime Minister of Norway, Erna Solberg, together with Omar Abdi, UNICEF Deputy Executive Director, Inger Ashing of Save the Children International, and Ayanda Makai, actor and activist from South Africa. Since the launch of Every Woman, Every Child 10 years ago, we have witnessed tremendous progress. However, amid deadly conflicts, COVID-19 pandemic and climate change, this report warns how gains have proven just so fragile, and the future now is more uncertain than ever before. In the next half hour, we will present the report's findings and make a global call, a rallying cry as such, for greater collaboration to urgently refocus efforts to protect the progress to date and prioritize the health of every woman, every child and adolescent everywhere. Under President Kaljulaid's leadership, alongside the Secretary General, Every Woman, Every Child has spearheaded the drive for the health and well-being of women, children and adolescents. Back in May this year, the President convened women leaders to rally around and take action to protect and promote the health and rights of women and children from the impact of COVID-19. This came just a day after addressing the UN Security Council and calling for the global community to put the health, rights, inclusion and protection of women and children at the very center of the COVID-19 response efforts. It is my honor now to formally introduce Kirsti Kaljulaid, the President of the Republic of Estonia and co-chair of the high-level steering group for Every Woman, Every Child, to give her opening remarks. Madam President, the floor is yours.
Thank you and welcome everybody. Thank you for your introductory remarks. We are just one decade since the launch of Every Woman, Every Child by former United Nations Secretary General Ban Ki-moon. More than 1 billion children have meanwhile been vaccinated. Under 5 deaths are an all-time low. We have witnessed steep declines in maternal mortality, and more than 122 countries have already achieved the Sustainable Development Goal target for under 5 child mortality. These important advances, they would not have been as successful or perhaps not attained at all in the absence of dedicated, focused work through the Every Woman, Every Child partnership, including its landmark global strategy for women's, children and adolescents' health. Every Woman, Every Child has mobilized 776 multi-stakeholder commitments for women, children and adolescent health and well-being, and it has generated $186 billion in commitments to advance maternal and child health. But it is not all good news, my dear friends. We still have worries. In 2019, 14,000 children under 5 died every day. Every 13 seconds, a newborn baby lost its life. Every hour, 33 women did not survive childbirth. Almost 1 million adolescents died. At the start of 2020, the United Nations Secretary Antonio Guterres warned the world of some key issues threatening our progress and our future. Devastating conflicts arising from geopolitical tensions. The under 5 mortality rate in these fragile areas can be up to 3 times higher than in other countries. The existential climate crisis, the health and future of every child and adolescent worldwide, is under immediate threat from ecological degradation, pollution, climate instability. The evidence shows exposure to polluted air prenatally and during the newborn period is associated with many risks later in the life. Experts warned of a global pandemic, and now we have the COVID-19, which adds to inequities while also creates new ones. The responses taken to control the virus have disproportionately affected women and also children. The percentage of the world's children who received all the vaccines recommended by the World Health Organization has dropped to 70%. This is actually back where it was 25 years ago. We must protect the progress, and we must continue to support the global partnerships, like Every Woman, Every Child, that have embodied the SDGs and made the advancements a reality for some of the world's most vulnerable populations. We have collective responsibility to ensure that progress is not reversed by conflict, the climate crisis, or COVID-19. We must be resolute in honoring and respecting the commitments and investments made towards improving the lives of women, children, and adolescents. We must do this. We must work together. And you know, in May we discussed it and we decided to have regular briefs, regular information sharing among each and everybody of us who is involved in order to make sure that we will not give up on what we have already achieved. I would also like to thank every participant of Every Woman, Every Child on every continent. You matter a lot to me personally. Thank you all.
Thank you very much, Madam President. And it is indeed not all good news and really quite stark how things can unravel at this point. Let me now turn to Madam President of Norway, the Prime Minister, for her remarks. Norway is, of course, a global health leader, and its steadfast support for Every Woman, Every Child has, without doubt, helped shape and drive a lot of this progress. Just this year, 2020, when met with this unprecedented challenge from COVID, Norway co-hosted the Coronavirus Global Response Summit in May that mobilized $8 billion. This included $1 billion pledged from Norway to Gavi, the Global Alliance on Vaccines and Immunization, which will help vaccinate 300 million children from infection, from diseases, and save 8 million lives over the next 5 years. I'm delighted now to formally introduce Erna Solberg, the Prime Minister of Norway and co-chair of the Secretary General's Sustainable Development. Over to you, Prime Minister.
Thank you very much. And I'd like to start by saying I'm pleased to join you on celebrating the 10 years of Every Woman, Every Child initiative. As you said, Norway has been a staunch supporter from the start. To reach the SDGs, we have to scale up the health-related services and the solutions both for women, children, and adolescents. And we must deliver on the SDGs critical for health, such as those who are related to education, nutrition, water, and sanitation. Every Woman, Every Child has succeeded in fostering collaboration to support governments and in delivering concrete results. And we live in a shifting development landscape where we are facing an existential climate crisis, a historic level of conflict, as well as an ongoing pandemic. And what global crisis really needs, they need global solutions. So partnerships such as Every Woman, Every Child movement has and are essential in these efforts. And the progress report shows impressive results since 2010. Nearly $186 billion has been mobilized by governments and other stakeholders during this decade. It has resulted in a significant progress. For example, rotavirus vaccine coverage, postnatal care and treatment of pregnant women with HIV. Important results for women all over the world. Norway hosted the Global Financial Facility replenishment in 2018, which mobilized more than $1 billion from 13 multi-stakeholder partners in support for Every Woman, Every Child. We will seek to ensure the financial support is given to investment and innovation that will deliver the best results. And we support the focus on results in implementation and support to partner countries in the new global financing facility strategy for 2021 to 25. The COVID-19 pandemic has made persistent inequalities worse, and it has created new ones. Action taken to control the virus has disproportionately affected women and children. Immunization rates have dropped, learning outcomes have declined, and gender-based violence and abuse are surged. Poverty, hunger, and food insecurity has all increased. Norway supports a coordinated international response to the pandemic. We are co-chairing the Facilitation Council of the ACT Accelerator and will make every effort to ensure equitable access to vaccines, tests, and treatments, and to ensure that no one is left behind. The principle of leaving no one behind is more important than ever, and it really means to make sure that women and children are taken care of. These and other partnerships are vital in both short and longer terms. They will help us to recover more quickly from the pandemic and to prevent further setbacks for the most vulnerable groups. And universal healthcare cannot be achieved in the countries that have been hardest hit by COVID-19 unless we manage to intensify and scale up global cooperation. If we fail to make lasting progress on universal healthcare, we will all be more vulnerable wherever we live. So my government and I am determined not to let this happen. That is why we will continue to support collective action through partnerships such as Every Woman, Every Child.
Thank you very much, Prime Minister. And of course, we've learned so much about coordination through this very mechanism and the importance of that coordination going forward. Let me turn now to Unicef Deputy Executive Director Omar Abdi. You heard from Norway there about the importance of global solidarity at this really crucial time. And what for you is really the most important, that sort of sense of these trends that you've seen over the last 10 years? What's alarmed you most about where we are now, and what solutions do you propose to get progress back on track now?
Thank you, Sarah. Good morning, good afternoon, good evening. On behalf of everyone at Unicef, it's a pleasure to join our partners to launch this report. The report is a reality check, a reminder of how far we have come and how far we have to go. Our progress has been impressive. Since the launch of Every Woman, Every Child, more than 1 billion children have been vaccinated. Under 5 deaths are at an all-time low. Coverage of immunization, skilled birth attendants, and access to safe drinking water reached over 80%. Under 5 HIV infections have fallen by half, and 25 million child marriages have been prevented. This is the effort of every one of us under the Every Woman, Every Child architecture, with a strong leadership from the UN Secretary General. When we add these achievements to those in other areas critical to children's lives, like child nutrition and education, the picture becomes clear. Together, as the Prime Minister said, the world is heading in the right direction when it comes to child and maternal health and survival. The right direction, but the wrong speed. Because our progress has been imperfect, uneven, and not fast enough. As the co-chairs highlighted, every 13 seconds a newborn baby dies. Every hour, 33 women die during childbirth. And 1 million adolescents die each year from preventable causes. We must do better, and we must do more, especially in those areas where over 80% of these deaths are concentrated, Sub-Saharan Africa and South Asia. While these trends predate the pandemic, we must face the fact that COVID-19 has added a new urgency to our work. The pandemic has put health systems under enormous strain. Millions of women and children are facing disruptions in routine services for immunization, disease treatment, and anti and postnatal care. In short, we must use this moment and this report as a rallying cry to every country to invest in women and children's health, to reimagine health systems that can truly reach every woman and every child, no matter who they are or where they live. First, UNICEF calls on world leaders to make bold investments in primary healthcare systems at the community level. Women and children must be able to access the services they need where they live. These investments and actions will also bring us one step closer to our shared goal of universal health coverage, an essential ingredient in a better, fairer, and healthier world. And second, these investments in health systems must also be matched by equally bold investments in all of the systems that support good health: water, sanitation and hygiene, nutrition and food systems, education, mental health, and social protections to help families make ends meet and invest in their families. The report we are launching today shows that recovery, resilience, and progress in health is possible. When we work together and help spark the political will to invest in the systems that support people's health, we can drive achievements like the ones listed in this report. UNICEF stands ready to lend our expertise, experience, and global reach across more than 190 countries to this important work. We look forward to continuing this journey together and reimagining health systems that can truly support every woman and every child. Thank you.
Thank you very much, Omar Abdi. Yes, indeed, we're going in the right direction, but certainly at the wrong speed. And now you've really hit a road bump, haven't we? Turning now to the Chief Executive Officer of Save the Children International, Inger Ashing. You heard from the Secretary General earlier this year, right at the start of the pandemic, the urgent call for a ceasefire, and again just a couple of days ago at the General Assembly. And of course, women and children are hit, particularly in the humanitarian and fragile settings. They're hit the worst because of the secondary impact of the pandemic. Save the Children has just conducted a really major survey, haven't you, on speaking directly to thousands of children from around the world. What have you learned from them, and what are your priorities now going forward?
Thank you. As you say, and as speakers have been saying before me, that the global COVID-19 crisis stands to reverse progress in reducing preventable child and maternal deaths. The most marginalized and vulnerable, many of whom are already struggling to stay healthy, are being pushed even further behind. In humanitarian and conflict-affected countries, where mortality rates are already significantly higher, the pandemic, together with the climate shocks, will add further vulnerability for women and children. Years of experience working on public health emergencies has taught us that when crisis strikes, children are highly vulnerable to its effect, particularly girls, the disabled, and others with intersecting vulnerabilities. In our global survey of over 25,000 children, parents, and caregivers, we asked children what they wanted from their leaders. We heard from a 16-year-old girl from South Sudan that she wants her government to protect people from coronavirus and help us with health services by bringing medicines for everyone. A 14-year-old girl from Somalia told us, "In my village, we don't have good health care, and the closest one is far away." While a 17-year-old girl from Afghanistan said, "Health facilities for women, especially pregnant women, should be increased." The survey helped us understand the impact COVID-19 is having on children and their families. Nearly 90% of those surveyed described struggling to access health care, with 2/3 having issues getting the nutritious food they need. Moreover, mental health and psychosocial support services are ill-equipped to respond to increased demand created by the pandemic. We know that the situation will be worse in humanitarian and conflict settings, where health systems are already fragile. For children and communities dependent on humanitarian assistance, the consequences could be catastrophic. The populations are facing conflict, weak national governance, scarce clean water, rising food insecurity, and teetering health systems, all now compounded both by the pandemic and the climate crisis. Just last week, the UN issued a warning on the risk of conflict-induced famine in the DRC, Northeast Nigeria, South Sudan, and Yemen. In those contexts, and almost certainly more, we are likely to see more deaths due to disrupted health services and widespread hunger than from the pandemic itself. Urgent action is needed to scale up the global response. Global solidarity must drive decision-making with quality and adequate financing that strengthen the capacity of both humanitarian responders and national health and nutrition systems, which is crucial to respond to the needs of the most vulnerable communities and ensure that continued delivery of service. The children that we speak to daily are acutely aware of their needs, and they do have concrete suggestions for solutions to the problems that we are facing. We must listen to them, and we must give them a stronger role in making decisions that directly affect their lives. We must invest in their participation, and we must create inclusive spaces for this to happen in the next decade of progress and beyond. Thank you.
Thank you very much there to Save the Children. It's an astonishing figure, 90% who are losing out on access to health services, so the impact may even be more severe than the pandemic itself in some parts of the world. Now, in the light of COVID-19, MTV Staying Alive Foundation partnered with Every Woman, Every Child and created MTV Sugar, Alone Together, a 50-episode series produced under lockdown to inform, educate, and provide support during the pandemic. We have leading actor Ayanda Makai right here with us from Mpumalanga, South Africa. Welcome. Ayanda plays Saul, who's a pretty evil character with a history of sexual violence. Ayanda, clearly the data indicates that COVID-19 is increasing the risk of violence in the home, violence against women and girls. What role are you playing to support young people exposed to violence and in abusive relationships, both as an actor and as a young man living in a country with one of the highest rates of femicide and abuse against women in the world?
Hi there, Sarah. Thank you for having me. And right now, as you said, the pandemic is quite high. And when it comes to gender-based violence, things have become a bit more extreme, especially now that in relationships, people are forced to be in the same environment. People are dealing with other stresses, such as unemployment. People have lost their jobs. People have lost family. Stress levels and anxiety is quite high. And South Africans tend to have a way of dealing or turning to alcohol for such high stress. So there's also alcohol that's coming into the picture. So gender-based violence in itself has kind of just peaked to another level. Children are in danger because now they're not at school, they're forced to be at home. And so men are in essence turning out and expressing themselves and their stress through the violence. Now it begs the question, what is our role? So MTV Sugar, what it does is that it has the beauty of reflecting reality and society in a very honest manner, but in a language that the youth understand and in a language that the youth speak, whether it be through their entertainment, through music, through the actors they see, and through the stories being highly relatable. And so what we've done is to ensure that the stories we tell reflect every single detail of the relationship and situation that people are in, but also we give them solutions of if you see signs, if you see a particular sign, and we tell that through a character. If you see a particular sign, these are the hotlines you could call. We've partnered up with Love Life. These are the hotlines you should call, and what are the certain steps that you could take to protect yourself. Also, I think it's high time that men become part of the conversation. That's where the change begins. It's high time men start talking to other men. And so what I am trying to do as an artist and through my partnership with MTV Sugar is that I'm turning towards the boy child. And I'm saying it's okay to feel emotion. It's okay to talk. It's okay for you to express when you're going through something instead of bottling up everything and resulting to violence. as a way of letting that out. And so we are changing the narrative of saying that men don't cry. We are saying men do talk, men do cry, and men need to start unpacking and making these uncomfortable conversations highly comfortable. Men need to start calling each other out and saying, you speaking to your partner, to your sister, to your mother, to your child in a particular manner is inappropriate, and in itself is a form of abuse, and that's what we're trying to change. If you look at the stats of when now South Africa has gone down from level 5 of lockdown and has gone down to level 1, in terms of the ER numbers, we have decreased by 80%. And the majority of that has been based on alcohol. Alcohol fatalities, alcohol violence. And so it begs the question, what role did alcohol play at home when it comes to gender-based violence? And so we're starting to then to ensure that we tell men how to handle your alcohol. Why is alcohol the answer to your problems when you're going through something? Who can you reach out to? And we're starting to also ensure that us as young artists and as young advocates, that we start creating a culture of mentorship for young boys. There's always been a lot of mentorship that has been dealing with the young girl child. But it's high time that we, as men who have voices, start turning back and showing the young boys and the children coming up that, because there's a perception that you got to be a cool kid, and to be a cool kid, you got to be a bad boy. And so we need to start painting a picture that good men are cool kids. Yeah. And that's what, in essence, we need to start changing.
It's a very important point, Ayanda, about focusing on boys. I'm going to have to move swiftly along now because we have the final closing video. Thank you so much for your remarks. We have the final closing video, and then I'll come back to me for any quick questions and hopefully some answers from the press corps. So we're going to play the video now from Amina Mohammed, Deputy Secretary General.
11 circles, no?
Excellencies, ladies and gentlemen, dear friends, I want to start by thanking President of Estonia and Prime Minister Solberg of Norway for their leadership and unwavering commitment to improving the lives of women, children, and adolescents around the world. Today marks the 10th anniversary of Every Woman, Every Child. We've heard of the successes since its launch: steep declines in global maternal and child mortality, 1 billion children vaccinated, and millions of child marriages prevented. These could not have been achieved without this global partnership. But our gains have proven fragile amid the COVID-19 pandemic, deadly conflicts, and the existential threat of the climate crisis. Leaders everywhere are focused on fighting the pandemic while trying to keep societies strong and resilient. As we search for solutions, we must take a broad view. We know that women and children are the foundation of our communities and of our future. Plans to respond and recover from COVID-19 must prioritize their rights and ensure continued access to services that support health, access to clean water, sanitation, nutrition, and education. While much is still unknown and uncertain, our collective goals endure for women, children, and adolescents everywhere to survive and thrive and to build their lives to be transformed. Today, I call on each of you to join the Secretary General in refocusing our efforts to usher in a decade of ambitious action to protect progress for every woman, child, and adolescent everywhere. Women and children are the face of the decade of action ahead. In 2030, we will judge our successes in delivering the SDGs by the lives we have saved and transformed. The need to harness the positive power of multilateralism and partnership with a common vision for change has never been more urgent. To keep momentum for maternal and child health and recover strongly from the COVID-19 pandemic, we must achieve universal health coverage, strengthen accountability, and invest wisely. The return on this investment and its positive ripple effect will be transformational for families, communities, and societies at large. There is no time to lose. Let us commit to the challenge of protecting our progress, to achieving the 2030 Sustainable Development Goals and to refocusing our efforts to prioritize the health and well-being of women, children, and adolescents everywhere.
Thank you very much to Amina Mohammed for those final words from our panelists and for this briefing. It's been a very packed half hour. You can find all the other resources on everywomaneverychild.org, including an open letter signed by leaders and worldwide committing to solutions. You heard from Amina Mohammed, no time to waste. As this pandemic has shown, no one is healthy effectively until everyone is. The letter is now open to the public for endorsement. The talk does not end here, and the action is out there. It's over for me, Sarah Crowe, your host. Please send in your messages, your questions to the media team. Thank you, and over and out.